Hey, this is Dr. Dan from Townhouse Solutions. I wanted to go over an exercise that I had to give up for a patient today called a median nerve floss, or a neurodynamic movement, they sometimes call it. Basically, this patient had a traction injury to her neck. It jacked up her median nerve, and a couple of her fingers went numb and that type of thing. So I wanted to give her this exercise for homework, but I couldn't find a video of it on YouTube, so I figured I'd just make a video of it and send this to her. So we're gonna put it out there for the benefit of the people. So basically, nerves are very hard. If you ever get a chance to touch one, if you're ever in a cadaveric dissection lab, and you get to touch a nerve, it's almost like clothesline cable. Like, it's very, very stiff. And the thing of it is when you pull something like clothesline cable and you pull it hard enough to hurt it, it means it pulled really hard. And it takes a long time for nerves to heal, as everyone knows. So what we want to do is we want to try to glide the nerve along its pathway, just like a piece of floss through a tooth to get some roast beef out or something like that. So the idea here is that we want to avoid a double traction type of thing. So we have our nerves that go down our spinal cord, they come out the neuroforamina of the spine and go down into the arm. What happens is if I have something going on and I want to tension the nerves on the left side of my neck, if I move my head over to the right side, this is mirrored for you guys. So if I move my head to the left side, I will pull the nerves from my arm towards my head. All right, and if I lean over the other way, that will slacken those nerves. Same thing with my arm. For the median nerve, if I stretch my arm way out behind me, like I was doing a door frame stretch on for my pecs, and I tilt my hand all the way backwards, well, that stretches my median nerve to its maximum capacity. Now, if I was to stretch my median nerve to its maximum capacity and move my head away, well, that would be a double tension position. I'd tension it from the bottom, from my hand, and I would be tensioning it from my neck, which would pull my nerve even more than it already was. So that's not really an ideal situation. That's not flossing. You don't floss by pulling both ways as you try to floss it through your teeth. You don't pull both of them. You slack one end off as you pull from the other side and go back and forth. So that's what we want to do with a nerve floss, is we want to start out, if we're going to tension it from the bottom, we want to slack it from the top. So we want to move our head towards where we're moving our hand. And then if we slack it from the bottom, we want to tension it back to the top so that we're gliding this nerve in along its pathway. So tension to the bottom, slack from the top. Slack from the bottom, tension to the top. Back and forth. Basically what you want to do is you never want to have your hand for the median nerve, you never want to have your hand and your head pointing away from one another. You always want them to point the same direction or the same direction. You never want to go double tension. You can start off with a nerve floss, like maybe I always tell people to start slow, go low and slow. So you can start off with, say, 10 reps, maybe twice a day, see how you handle that. And then you can increase in 10 rep sets throughout the day. I get people worked up to around 100 repetitions. The thing with nerve flossing is as you do it, if the nerve is, say, pinched in my forearm, and there's some muscular adhesion around that, and I'm flossing through that, well, that's going to be very irritated, and that's what might even hurt more before it gets better. So that's not unusual. The other thing with doing a neurodynamic treatment or a neurodynamic self-care exercise is that it might make wherever the primary entrapment site, I just said in my forearm, but if it's in the neck, it'll start to what they call centralize, all right? So it'll come out of your fingertips and start to move up your arm and into your neck. So your neck might be a lot more sore by the end of this, but your hand should be less numb, all right? The other kind of, little bit of a warning that goes along with this is if you can't get that full arm extension, because even with it slacked off, even if your head's over there and you can't get that full arm extension, you can shorten it up. All right, you can bend the elbow some, you can let the shoulder come down some, you can not bend the wrist all the way back, you can shorten the movement up so that you're getting tension in there. The worse the nerve injury is, the worse the impingements upon the nerve from the muscles and the bones and the joints, the less distance you're going to get. I don't have a median nerve issue. I can go all the way back and I can tilt my head all the way to the side and my hand doesn't go numb. But if somebody did, you might only be able to get it so that you can stretch your arm all the way out, but you're not tilting your hand backwards, you're keeping it forwards, right? And then as you work with your nerve floss, you might be able to get it so that you can eventually do it all the way back. So you kind of phase it out a little bit. There's some other good video resources out there. I just want to do one. I've never seen anybody do it without a rotational component. I like to do a non-rotational component first, and going down the line, we can get into some other stuff. But for now, see if I can stop. For now, that's going to be it. All right, have a good night.